Hi there, my name is Greg Prowse. I am the producer of the Mind Over OCD. This is an empowerment course, and this is a rather kind of comprehensive course where you can help to deal with your OCD problems. Now, the agenda today, we're going to do an overview, we're going to do an overview of OCD itself. We're going to go over understanding OCD, cognitive behavioral therapy, or CBT, as you might be already familiar with, mindfulness and relaxation techniques. Number 5, building coping skills, developing an OCD management plan, addressing specific challenges, maintaining progress and preventing relapse, and conclusions and next steps. Now, for the module 1, first off, definitions and symptoms. Obsessive compulsive disorder is basically a mental health condition categorized by persistent and intrusive thoughts or obsessions and repetitive behavior or behaviors, or mental acts known as compulsions. These obsessions and compulsions cause significant distress, interfere with your daily function, daily life. Now, this is quite severe and it can be quite traumatic. And this is something that is really should be addressed and is really truly underrated. Here's some definitions and symptoms of obsessions. They are often accompanied with intense anxiety, fear, and may include themes such as contamination, fear of harm to oneself, perfectionism or unwanted to-do thoughts. Compulsions are repetitive behaviors or mental rituals performed in an attempt to reduce the anxiety, which doesn't always work and is not the way to go, or distress caused by the obsessions. However, these compulsions provide a temporary relief only and often lead to a cycle of increased anxiety and further compulsions. So you're going into, in essence, a vicious cycle, and the more you give into it, the more it gets worse, and in essence you can't break that cycle. You can forcefully, it's very traumatic and it just causes a lot of anxiety, but it's probably better to do that than give into the cycle to compulsion, because it's a never-ending loop. You think that sometimes, maybe once in a blue moon, you will solve that problem, but in essence you will not. 9 times out of 10, if not, or every single time, your OCD will become worse because the compulsions and rituals are just there, creating anxiety, pulling you into this vicious cycle. Now, the overview of how OCD is categorized by unwanted intrusive thoughts, also and repetitive actions. Explanation of obsession, thoughts and compulsion behaviors is another point. OCD can manifest in various ways and can range from mild to severe. It is a chronic condition as well that is typically requires ongoing management, but effective treatment such as cognitive behavioral therapy or CBT. Medications and mindfulness techniques can help individuals manage symptoms and improve their quality of life.